Hello dear aspirants, welcome you all to the Master Nursing classes. So as all of you know that we are discussing the very important questions for our upcoming RRB Nursing Superintendent exam. So we have successfully completed 3 days of the classes. So I am very much thankful to you all for the huge response towards that classes. Okay. So and I am very glad to hear those comments. That is very helpful for you all. Okay. So I am using the very beautiful tips that will actually works in your competitive exams. Okay. So the question papers discussion is not only reading the question and choosing the correct answer. So you have to know the all other three options also, and it is very important that previous year question papers will uh, like 10 to 15 questions including the 18 and 19 paper, there is highest chance of the coming the same question or a same concept. So that's what I am discussing, the same concept also. Okay, in detail each and every question we will discuss. So without wasting time, we will start the today's class, students. So before moving to the questions, here is one beautiful quote. So it's better to be disciplined more than the motivation, students. The motivation that can comes for a short period of the time. Okay, you will watch some videos on YouTube and you will get motivated. That won't work actually in practical. So how to be disciplined with towards your goals, that is a very important, students, and that makes you a champion, and that makes you stands out of the crowd, and that makes you get a good ranks in the exams. Okay, so yes, today's class we will start now. Okay, so here is the first question in front of you all. Read the question perfectly, carefully. Okay, then give a perfect answer for the question. Okay, so yes, question is like this: the period between the exposure of the infection, okay, and the appearance of the first sign symptoms, okay, is called as what we call this period, students. Yes, all of you have know the answer. Yes, I am waiting for your comments. Yet fatafat, who all are live to the class, do comment in the comment box. Okay, yes. Very good, very good. Yes, who all are commenting, that is the incubation period. Your answer is 100% correct, students. Okay, this is called as the incubation period. What actually incubation period? So here is the host. Okay, here is the host, and here is the causative agent. Here is the causative agent. Very simple. When this causative agent enters to the host, it will not produces the sign symptoms in one day, in half day. Okay, so some very few causative agents which produces the symptoms within immediate span of time. Okay, and almost many causative agents which requires a time duration to produce the sign symptoms. So that is what this incubation period tells here. When the it is the period between the entry of the microorganism in the host and production of the sign symptoms. Okay, like specific and non-specific sign symptoms. For example, consider if the one virus enters into the our body. Okay, which virus will consider? Yes, we can consider the virus like coronavirus. Okay, so coronavirus we will consider. If the virus enters into the body, there are sign symptoms like fever, cough, and congestion of the nose. Okay, so these are all the sign symptoms. The span between the entrance of the causative agent in the body to the production of the sign symptoms, this is what we call as the incubation period. Then what about window period, and where we will see the window period? Okay, so what is window period? So I hope this answer and question is clear for you all. Yes, this is the exposure of the infection to the production of the sign symptom, that is known as the incubation period. And the next question is very simple, that is what is window period? My question is what is window period, and make it a 5-star for window period. Okay, so window period is same here, students. Okay, listen carefully, only a minor difference is there. Window period is a period from entry of the microorganism in the body to production of the specific antibody to that microorganism in the blood. Okay, very simple. Okay, let me take a slide and explain you for perfect remembering purpose. Okay, yes, so consider him as a host. Okay, and this is the host blood vessel, and this is the beautiful blood of the host. Okay, in the blood vessel we have the blood. Okay, and here is the microorganism. Yes, this microorganism enters into the human body, and after entering the microorganism, our body produces the antibody that is specific to the this microorganism. The time span between the entry of the microorganism, okay, to formation of the specific antibody. Okay, formation of the specific antibody towards that particular microorganism we call that is in the window period. Okay, so that will specifically we will see in the HIV students. It's a okay lot of duration required for the production of the antibody against HIV virus. So a window period which matters a lot in the HIV. Okay, so I hope the concept for window period is clear, and that is what is a latent period here. Okay, what is latent period? This is simple students. Latent period is a yes the period where the microorganisms remains in the body in the hidden forms. Okay, so latent stands here as a hidden. Okay, latent stands here as a hidden, means the microorganism remains in the body without sign symptoms, and the latent period it comes out because of the improper treatment. Okay, so doctor will advise the injection augmentin for a duration of the 3 days, and patient takes it only for the 1 day. On the day 1 dose, the symptoms will reduce and the microorganisms remains in the hidden form, and day second he will not take treatment. So there is no improper treatment, means the infection remains in the body still yet. Okay, so still the infection is remains in the body and it will not vanish completely. So the infection which is there in the hidden form, that is known as the latent period or the latent infection. Hope the concept is clear. Yes, move to the next question. Yes, here's the next question. Very beautiful question, students. Okay, read the question carefully and give the answer. Yes, is that understand? Okay, then nice. Here is the question. That is the myopia is corrected by. Very simple, students. Myopia is corrected by. Here is the some lenses are there. Yes, which lens we will use for the myopia? Okay. So first now tell me what is myopia. Then we will go for the treatment of the myopia. It is very simple, students. The definition many times the examiner will ask. Okay. So at the end of the explanation, I will ask the 5 questions for you all regarding the refractory errors. We call this one as in the refractory errors. Okay. So you have to tell the answer for this one. Okay. Yes. So students, while discussing the refractory error, it is very important to know the what is the normal refraction. Okay. Consider one light source is there light here. Okay. So when the light source enters into the eye, here is the beautiful lens is there. Okay. This lens having the ability to bend the light rays. Okay, ability to bend the light rays. Okay, so that is what we call as the refraction. What is refraction? Refraction is the power of the lens to bend the light rays. Okay, that is what we call refraction. Okay, when the light rays bends perfectly on the retina. Okay, this is the our innermost layer of the eye, that is the retina. Retina is the sensory neuronal layer of the eye where it produces the light rays or the signals into the images in the our occipital part of the brain. Okay, hope the concept is clear. When the light rays bend perfectly on the retina, it produces the perfect image and person can able to see the normal distance images. Okay, so that one we call as the eumetropia. What is that? Is eumetropia. Okay, very simple. Yes, yes. So then what is the myopia? Yes, what is the myopia? Myopia is a condition, students. The lens works a lot. Okay, so lens bends the rays more than the normal. Okay, so look at this image. Yes, actually the rays should bend here on the retina, but the rays are bending over and it is forming in front of the retina. Means the image forms in front of the retina. That is we call as the myopia. Students, now tell me the answer. The lens bending over lights and it's which forming the image in front of the retina, means if I hold object very near to me, okay, very near to me, then the light rays goes somewhat behind. Okay, somewhat behind. Okay, yes, yes. So because of that, the person can able to see the object which is near to his eyes and he is unable to see the object which is far away from his eyes. So yes, this is what we call as the nearsightedness. What we call the myopia is also known as the nearsightedness. Yes, let me take a slide. Okay, myopia is also known as the nearsightedness. Okay, very important, students. Okay. Yes, near-sightedness means person able to see the object which is near to him and unable to see the object which is far away from him. Okay, because of what? Because of the this lens bending the rays more than the normal. Okay, if I keep the lens which is opposite to this one, like this. I will keep the lens opposite to this one. Means normally we are having the biconvex lens, students. This is our biconvex lens which bends the light more. If the convexity of the lens is more, like the lens becomes more convex, so it bends the light more. So it bends the light more means the image will form in front of the retina. That is very much dangerous for our retina. Okay, why? Because which pulls the retina towards the image, and sometimes because of the chronic condition there is detachment of the retina from our choroid. Okay, so second layer is our choroid layer. Sometimes because of the bending of the image in front of the retina, yes, sometimes the retina will come towards the image, and which it will get detached from the our choroid layer. We call that one as a retinal detachment. Okay, so we will discuss in detail while studying the ophthalmology, and already 4 and 5 lectures are there on my YouTube channel related to ophthalmology. You want to more details, you can watch those videos. Okay, very important. So what I told, the convexity of the lens more means the lens will bend the light more. Okay, so this is what we call as the convex lens. So how can I remember this is convex lens? Okay, you can make x inside this one. This is the convex, that is x. Okay, hope the concept is clear. And this lens we call this one as the biconcave lens. This lens what we call, this is biconcave lens. Okay, so I will keep this lens in front of the this eye in the form of the spect, okay, so this will be works opposite of this one, and the light rays will bend on the retina. Okay, the light rays will bend on the retina. Okay, so myopia is corrected with of the, yes, our biconcave lens. Okay, biconcave lens, very important. Yes, students, it's very important. Okay, yes, the myopia is corrected with the help of the, yes, where is the our answer? Yes, that is with the help of the biconcave lens. Yes, how the concept is clear. Then I will come to the, yes, farsightedness or hypermetropia. What is hypermetropia or farsightedness? It is very simple, students. As light rays bend in front of the retina, that is what we call as the myopia. If the light rays are bending, yes, posterior to the retina, means after the retina, what it means, the ability of the lens to bend the light rays decreased, and the focus of the light rays are going behind the retina, means that is what we call as the hypermetropia. Okay, what is hypermetropia? This lens is lost their ability to bend the light rays. Okay, so it is going behind the retina. Okay, our retina layer is here, students. Yes, and the light rays is bending here. Look at this image. Yes, the light rays are bending here, so means the light rays going, or the image going behind the retina, so means the ability of this biconvex lens is decreased. So I will keep the biconvex lens in front of this one. Okay, so it will helps, yes, to focus the retina. Yes, to focus the image on the retina. Okay, so this is how hypermetropia is corrected. Okay, so yes, that is the hypermetropia is corrected with the our biconcave lens. Okay, and nearsightedness is corrected with our hypermetropia is corrected with the biconvex lens, and nearsightedness is corrected with the biconvex concave lens. Hope the concept is clear here. Yes, yes. So now I will ask the 5 questions. You have to comment in the comment box. What is myopia? Yes, light rays bend in front of the retina. Okay, that is what we call as the myopia. Okay, then what is hypermetropia? Yes, light rays bend behind the retina. That is what we call as the hypermetropia. What is chief complaints in the myopia patient can complain? Patient can complain in myopia like, sir, I will see the object only near to my eyes, and I am unable to see the object which is far away from my eyes. That is myopia. That is also called as the nearsightedness. What is the chief complaint patient can tell in the hypermetropia? Yes, hypermetropia means the light rays bending behind the retina. Okay, if I hold the object away from my eyes, okay, means the light rays will bend on my retina, means the patient can see the object clearly which is away from his eye. Okay, so that is what we call as the farsightedness. Okay, very important, and that is also called as the hypermetropia. So these are the very basic refractory errors. Yes, you have to understand. Okay, yes, here is the next question. Hope the concept is clear. Perfect, students. Yes, yes. Answer the question for this one. Yes. Vaginal acidity is maintained by the very simple question, and I hope all of you will give the perfect answer for this. Yes, option is the Streptococcus, option B is the Borderline bacilli, option C is the Mycobacilli, and option D is the Acidobacillus. Yes, what is the bacteria which maintains the vaginal acidity? Students, I'm waiting for your answer. Fatafat do comment in the comment box. Very good, very good. Yes, who all are telling that is the Borderline bacilli. Okay, so that answer is very much correct. Now I will ask what is the another name of the Borderline bacilli. Sir, what you are asking, sir? Remembering the one bacteria name is very hard. You are asking the another name. Yes, students, it is very important to remember the another name of the few bacteria like uh, in the TB already I have told that is Mycobacterium tuberculosis also called as the Koch bacilli, and Borderline bacilli is also called as the also called as the very good students, that is the Lactobacillus acidophilus. Okay, what we call this one? Lactobacillus acidophilus. Okay, and what is the another name of the our leprosy? Can anyone answer? What is the another name of the leprosy? Very good students, that is the Hansen disease. What is the another name of the leprosy? That is the Hansen disease, also known as the leprosy. Okay, so there are many diseases which are having the another names. The examiner may interestly ask in the exams like RRB. Okay, that's what I am repeating these questions. Okay, so Borderline bacilli also known as the Lactobacillus acidophilus. Okay, Lactobacillus acidophilus. What it means? Yes, what it will do? It will convert our glycogen from the epithelium of the vagina to the lactic acid. Okay, what it will convert? It will convert to the lactic acid. So this lactic acid is acid, so it helps for the maintenance of the our vaginal acidity. Okay, so when there is a increase in the lactobacillus acidophilus or the Borderline bacilli, that time acidity will get increases in the vagina of the female. Okay, because of the this acid reduces the pH. Where there is the decrease in the pH, where there is a decrease in the pH, that means increase in the acidity. Okay, hope the concept is clear for this one. Yes, what are the other questions that will comes on the lactobacillus acidophilus or the Borderline bacilli? Yes, can we discuss? Yes, students, we should and must discuss this one. Okay, why? Because it is very important. Remember, whenever there is increase in the estrogen, that time increase in the our lactobacillus acidophilus will be there. How? What is the proof for this one, sir? If I ask what is the vaginal pH, what is the vaginal pH in female before puberty, means that is the 6 to 8, it is slightly alkaline. Okay, and again I should ask what is the vaginal pH. Okay, what is the vaginal pH in post menopause woman? Okay, in post menopause woman, again it is 6 to 8 alkaline pH. If I would ask the question like what is the vaginal pH in yes pregnant lady, in pregnant lady, okay, so the answer is 3 to 4. Okay, 3 to 4. If I ask what is the vaginal pH in reproductive age, in reproductive age, yes, the answer is 4 to 5. So 4 to 5 and 3 to 4. Yes, this will make confusion for you all. Okay, so remember the vaginal pH during the pregnancy is 4 to 5, repeatedly asked question, and the vaginal pH during the reproductive age is 4 to 5. We can say 4.5 also as a yes mean of this one. Okay, so sir, why it is changing according to age? So before puberty it is before puberty like vaginal pH is 6 to 8, after menopause it is 6 to 8. Students, before puberty there is no estrogen, because there is no any activation of the hypothalamic pituitary ovarian axis will be inactive before puberty, so no estrogen means no daughter line. After puberty, that there is no more follicles on the ovary, and yes, there is no more follicles on the ovary means again no more estrogen. Okay, so there is no estrogen in the menopause. In the menopause there is no estrogen, so again there is decreased estrogen, again there is in the increase in the pH, and yes, reducing the our acidity of the vagina. So this evidence that the lactobacillus acidophilus always depended on the which hormone, that is the estrogen. Okay, so we can make one statement here as a yes, daughterline bacilli or the lactobacillus acidophilus completely depend on the estrogen hormone. Okay, so sir, how it will changes here in the students in the reproductive age? Yes, the activation of the HPO axis is there, hypothalamus pituitary ovarian axis. So now ovary secretes in the reproductive age, estrogen will be there. Yes, that's what the vaginal pH will get decreases to the acidity, and in the pregnancy there overproduction of the estrogen is there. Okay, so that will makes more acidity. Okay, that will make more acidity, and this acid environment only gives the yes protection to the reproductive tract of the female. Hope the concept is clear. Okay, now I will ask the question. You people, you student must answer. I will remove this slide. Okay, yes. What is the another name of the daughterline bacilli? That is lactobacillus acidophilus. Then what is the pH in the vagina in the reproductive age? Yes, very good students. What is the pH of the vagina in the reproductive age? That is the 4 to 5. Very good. So that is the what is the pH of the vagina in the uh, pregnancy? That is 3 to 4. Perfect. So what is the pH of the vagina in before puberty and after menopause? Yes, that is the 6 to 8. Okay. So daughterline bacilli or the lactobacillus acidophilus is dependent on which hormone? Perfect, students. That is the estrogen. Hope the concept is clear for you all. Yes. So the simple questions and lots of the concept. So this is the actual way of the studying, and this is actually boost your marks in the exam, students. So there are many many questions will be there. We can explain a lot and give a best to best content. Okay, so simply changing the question and putting the answers that you can get in your book also. So this is what you have to study the concept. Okay, so concept you brings the yes the rank, students. Yes, here is the next question in front of you all. Yes, please read the question carefully completely, and we will move forward to the answers. Okay, so yes, the question is very simple here. Read the question yourself fast and give the answer for this question. Is dash denotes who never completed a pregnancy to the stage of viability. Yes, what is the following word that denotes that? So the female who never ever completed a pregnancy to the stage of the viability means, yes, the female is pregnant but she didn't go till the period of viability. What is period of viability? Period of viability is that, yes, the word itself says period of viability means ability. Okay, so it is the ability of the fetus. If it comes out of the womb of the mother, it can live independently. Okay, so it can take its own breath. So that is what we call the period of viability, means ability of the fetus to get live the life. Okay, so with basic uh, establishment of the physiological functions, like after this period we can say the baby can breathe independently. Okay, the heart rate will be very active, and he can baby will be able to maintain the body temperature. So that is what the period of viability. So what is the period of viability, students? There are many books which are saying the many months and weeks. So now WHO said the period of viability is completely depend on the weight of the baby. Okay, if the period of viability, yes, the weight of the baby is more than 500 gram, it is able to live. Okay, if the period of viability which is less than 500 gram, which is unable to live. Okay, so yes, the according to WHO, what is the weight for the period of viability? That is the 500 gram should and must would be the yes weight for the period of viability. Hope the concept is clear. So what I am telling here, yes, which word which denotes the yes the female who never completed the pregnancy till the period of viability means the female is pregnant. The female is pregnant, but she didn't went till the period of viability. So what is the word of this meaning? Yes, very perfect, students. Yes, who all are giving the answer as a nullipara. That is your correct answer, students. Yes. So how means, what is nulli? Nulli means so never. Para means number of the birth. So the definition of the nullipara is the mother or the pregnant lady who didn't cross the period of viability, or the pregnant lady who didn't given a birth to the baby. That is the nullipara. Then what about the nulli gravida, the word which complain which creating confusing for you all? So nulli gravida is very simple, students. Nulli gravida is again, nulli means yes never. Okay, so nulli means not happened. Okay, gravida means again Yes, the pregnancy. She never ever pregnant only. So one time also the pregnancy not happened to that particular lady. We can say that is a nulli gravida. Okay, she is pregnant, but the pregnancy which didn't cross the period of viability, that is what we call as the nulli para. Okay, so then what is multi gravida? Multi means more than one. Gravida means pregnancy. Okay, so yes, the pregnancy which are the mother pregnant more than one time. That is what we call multi gravid. Okay, so what is pure feral? Pure feral is a period. Okay, pure feral is a period where the mother will start recovering after the delivery. Okay, so that is what we will call as the postpartum period or the pure feral period. So pure feral period will be last up to the 6 week of the yes duration. Okay, so it will last up to 6 week of the duration where the big uterus comes to the normal size. Okay, where the our cervix region comes to the normal size. Vagina also it will comes to the normal size. Okay, the height of the uterus will decreases. Okay, and there are many internal genital organ changes will be there in the post puerperal period. We will discuss the rate of changes and everything in detail while studying the puerperal period. Okay, so now you have to remember what is the normal duration of the puerperium. That is 6 week. Okay, so it is multigravida. Yes, the number of pregnancy more than one time, that is multigravid, or it is nullipara. Nullipara is pregnant, is female is pregnant, but she didn't given the birth to the baby, or the female is pregnant, then she didn't cross the period of viability. She what we call her as a nullipara. Okay, so what is nulli gravida? So female is not even one time pregnant. That is what we call as the nulli gravida. Hope the concept is clear. And in this particular one question, we have discussed the 4 more questions. Okay, so now one more questions that will comes in your upcoming NORCET and RRB exam. So that will help. So what is the parturient? What is the parturient mother? What is the parturient mother? Students, parturient here is the very simple. The mother who is in the labor ward. Okay, so like lying or the yes, she is in the process of the labor. Okay, she is lying on the labor table. So this mother we call as the parturient mother. Okay, so this mother we call as the parturient mother, means the mother who is lying on the labor table in the labor ward. So she is in the process of the labor. This mother we call as the parturient mother. Okay, so hope the concept is clear for this question. Yes, here is the next question. Yes, very simple question. So all of you can give the perfect answer for this one. So today's questions more related to OBG, ophthalmology, okay, and cardiology. Also, the few questions are there. Very nice questions that will repeatedly asked in your exam. Okay, so what is the process involved in the development of the mature ovum? So what is the process which is involved in the development of the mature ovum? So yes, all of you should and must answer for this question. It is a very easy question. Okay, so 0 level question, I can say the basic level question. Yes, very nice, students. This is what involvements make you to think correctly and give the correct answer. Okay, so who all are live and not commenting? Okay, so try to comment for each and every questions that makes you uh, completely involved in the class. So no problem if the answer is wrong. I am here to clear your concept here. Okay, so no need to worry about that. Okay, yes. What is the process involved in the development of the mature ovum? That is what we call as the yes oogenesis. Oogenesis is the process of perfect students. That is in the development of the mature ovum. So I will ask 5 more questions on the oogenesis. You should and must answer for this question because repeatedly the questions they will ask on this particular topic. What is the definition of the oogenesis? Yes, oogenesis is the process of formation of the primary oocyte to the secondary oocyte. So this is what the OBG tells us. Yes, what is the oogenesis? Oogenesis is the process of formation of the primary oocyte to the secondary oocyte. Yes, this is our primary oocyte. On the primary oocyte, so we have the follicles. We have the follicles. So primary oocyte with follicles, we call this one as the primordial follicles. So this will be converted into secondary oocyte, means in the secondary oocyte the ovum will get converted. Okay, then this follicles become the corpus luteum. Okay, so this primary ovary become the secondary oocyte, and this primary oocyte become the secondary oocyte, and the follicles become the corpus luteum. Now my question is, which hormone which is responsible for converting the primary oocytes to secondary oocyte? Yes, that is the LH. That is the luteinizing hormone, is the hormone which is very much responsible for the formation of the secondary oocyte. So now tell me the definition of the oogenesis. Oogenesis is the process of a formation of the secondary oocyte from the primary oocyte with the help of the luteinizing hormone. Okay. So my question is, which hormone which is responsible for the oogenesis? That is the LH. Okay. So what is the definition of the oogenesis? It is the process of formation of the secondary oocyte from the primary oocyte. From the primary oocyte, secondary oocyte production. That is what we call as in the oogenesis. Okay. What is the normal lifespan of the ova? Okay, that it can able to reproduce. Okay, what is the reproduction ability duration or the normal lifespan of the ova? Can anyone tell? Yes, very nice, friends. That is the 12 to 24 hours is only normal duration of the ova, where it can after production it can able to fertilize. Okay, so we can say the fertilization durability of the ova or the normal lifespan of the ova. So the answer remains same here. It is a 12 to 24 hours. Now the question is like one more question. So what is the normal lifespan or the duration ability of the fertilization of the sperm? Yes, can anyone answer? Very nice, students. That is the 48 to 72 hours. Okay, this is the 48 to 72 hours is the the normal fertilization ability duration of the sperm. Yes, that is the 48 to 72 hours. Normal lifespan ability of the ova, that is the 12 to 24 hours. Okay, so hope the concept is clear here. Yes. Okay, then what about fertilization? Fertilization is a very simple term, friends, where you all people have read in your PUC. Okay, yes, and in your first year of the basic nursing. Very simple. Okay, from one side the sperm will come, and from another side ova will come. From the male, sperm will come. From the female, ova will come. So this is also haploid, this is also haploid. What is haploid, students? This is also having the half chromosome, that is the 23, and this is also having the half chromosome, that is the 23. So the process of fusion of the male gamete or the female gamete, we can say, or the process of the fusion of the sperm and ova, which is called as in the fertilization. Okay, this process we call as in the fertilization, and the outcome of this process would be the zygote. What is the outcome of this process? That is the zygote. Okay, what is the zygote? Zygote is the fusion of the sperm and ova is the zygote, and the process of the fusion of the sperm and ova or the female and male gamete, that is called as the fertilization. Okay, hope the concept is clear. And yes, if the examiner asking the question whether the zygote is haploid or diploid, we can say this one as in the diploid. Okay, so we can say this one is the diploid. Students, here one haploid and another haploid fuses together, and which makes the diploid. Okay, the male gamete or the sperm is haploid, and the female gamete, the ova, is haploid, and the zygote is diploid. Hope the concept is clear. Yes, very nice, students. Yes, here is the explanation for the fertilization. Okay, yes, next gametogenesis. Again, the process of formation of the ova is the oogenesis, and the process of formation of the sperm is the spermatogenesis. So both together we call as the gametogenesis. Okay, so already I explained for the spermatogenesis. Yes, hope the concept is clear for the previous question. And here is the next question. Yes, all of you have marked the answer as oogenesis, correct. And 5 questions on the oogenesis is clear. Yes, all possible questions. Yes, very nice. Here is the next question. Very simple question, students. The larynx is closed during the swallowing by. Yes, larynx closed during the swallowing. If you are having some food, water, okay, some like groundnut, it will not go into our trachea. It will go into the esophagus. Why? What is the part of the body, or we can say the organ, which is responsible for closing the larynx or trachea? To close the larynx, and it will help for entering into the taken food into the esophagus or GI system. Yes, that is the, all of you have given the correct answer. That is the epiglottis. So yes, that is the correct answer, epiglottis. Now yes, what is the competitive term we can say for the epiglottis? Yes, this is also called as the policeman of the GI system. Okay, or we can say this one as in the traffic police of the GI system. Why it is traffic police? Students, can any one of you have seen the traffic police who is standing at the signal and diverging the people to go right, to go left, to go straight, to go back, like, okay? So same here, epiglottis tells the food or the fluid to go into GI system, not to go into the trachea, to go into the GI system, not to go into the trachea. So that is what the epiglottis, also known as the, yes, that is tropic police of the GI system. And epiglottis is made up of the, yes, epiglottis is made up of the, that is our elastin cartilage, okay, or you can say the elastic cartilage, okay. Remember students, so the elastin or the elastic cartilage, okay, which makes the three E's, okay. One is the epiglottis, one is the eustachian tube, and another one is the our ear pinna, okay. One is the epiglottis, noted down, very important. One is epiglottis, one is the eustachian tube, and another one is the ear pinna, okay. Yes, so where is our ear pinna? All of you can feel that, yes, yes, very good. So epiglottis we have discussed. Then eustachian tube is the tube which connects our middle ear into the nasopharynx, okay, which helpful for the balancing of the sound by increasing or decreasing the pressure, okay. So that absorbs the pressure, okay, and which connects the nasopharynx to the middle ear, okay. So it which connects our oral cavity and our like uh, ear cavity, okay. That is the connection between the middle ear of the ear to the nasopharynx. That is what we call as the eustachian tube, okay. So yes, very simple. Then what is ear pinna? Ear pinna is also, can anyone feel that ear pinna? Yes, perfectly, okay. So these all three E's are made up of the elastic cartilage, okay. The question asked in the exam, okay, and this will comes again in your RRB exam. Remember students, okay, very helpful. Yes. Then next, what is cricoid cartilage or thyroid cartilage? Can anyone tell the our Adam's apple in male, like this protrusion, this Adam's apple, this protrusion is there in our neck, no? So what it is made up of the which cartilage? That is the, yes, thyroid cartilage. And what is the Weiss box? Weiss box is our vocal cord, okay. So hope the concept is clear for this one. Yes, yes, very nice, perfect students, okay. So try to give answer for this question. This is the 10-star question for your upcoming NORCET also and upcoming, yes, RRB exam also. Consider this one as the 10-star concept. This particular concept, what I will teach now, will definitely strike in your upcoming NORCET prelims and even in mains and in your RRB exam also, okay. So don't neglect, listen carefully first while I am teaching, then I will revise it, okay. By asking the question I will revise it, so that will be very helpful for you all, okay. So yes, perfect, okay. So how are ECG changes presented in the ischemia and myocardial infarction? Now tell me the answer. I am waiting for your answer. So what is the ECG changes in the myocardial infarction? Simple question is there. ECG changes in the myocardial infarction. Yes, can anyone tell the answer? Option B is telling that is the elevated PQRS complex. In never ever, in any condition, all PQRS, no, it is not possible, okay. So it is not practically possible option, okay. Option C is that as a larger Q wave and P wave. So I would have accept if it is something abnormality in Q wave, but there is no any abnormalities in the P wave in the myocardial infarction. So I am eliminating this option as well, okay. So option D is as a depressed ST segment. Yes, as a depressed ST segment. I will consider this for some duration of the time, and I am moving forward to the option A. Yes, option A is telling that as a small Q wave, yes, there is absolute pathological Q wave will be there in the myocardial infarction changes. Okay, then elevation in the ST segment, then perfect option. Okay, then there is peak or inverted T wave is there. Yes, students, these all three changes will happen in the myocardial infarction. These all three changes happens in the myocardial infarction. So not only ST segment depression and elevation, so there is chance of yes pathological Q wave also, and ST segment elevation, and yes the inversion or the peak T wave will be the yes ECG changes which we will see in the our myocardial infarction. So look at the rationale here. The ECG changes in the myocardial infarction. Okay, so make it a take a screenshot of it, this one, or else write it in our last minute revision notebook. So ST segment elevation, ST segment elevation will be there, and pathological Q wave will be there, and T wave inversion will be there. So my question is whether T wave elevation will seen or not. T wave elevation, yes, whether it may be elevation or it may be inversion. Now my question is, what is the earliest changes? What is the earliest changes in the ECG? Okay, that telling you regarding the myocardial infarction. Yes, the earliest changes is the tall T wave. Sir, tall T wave will be seen in the patient with like hyperkalemia also. Yes, students, here in the myocardial cells, because of the increased potassium only, tall T wave seen. How, sir? How means? So this is the myocardium. Okay, myocardial cell you consider. So what am I? What is the myocardial infarction, or what we can say that is a heart attack? If there is complete blockage in the coronary artery, which supplies the blood to the our myocardial muscles, so it will leads to the ischemia and infarction. Okay, so whenever there is infarction means the death of the myocardial cells. So this myocardial dead cells, yes, this is myocardial dead cell. Whenever there is a cell is dead, cell is ruptured, the potassium will come out. Okay, the potassium will come out. Okay, so that is what increased potassium. So that is what, yes, elevated T wave we will see as the earliest changes in the myocardial infarction. So my next question is which of these among three option, which ECG changes which is telling the patient had myocardial infarction previously, means yes, that is the old case of the myocardial infarction. Yes, which option? Perfect, students, very nice, shabash. That is the pathological Q wave which tells the yes previous myocardial infarction. Students, this is what I told the myocardial cell, and this is what I told the coronary artery. So when there is blockage which leads to the changes in these all three ECG changes, if I remove this blockage, okay, and I will establish the perfect circulation to the myocardium, okay, so by like CABG or by removing that particular emboli, okay, so I will re-establish the circulation to the myocardium. Okay, whenever I will re-establish the circulation to the myocardium, all ECG changes comes to the normal, but Q wave remains abnormal, and so that is what the Q wave tells that the patient had the myocardial infarction previously. Okay, so that is very important. Okay, so which wave which will not comes to the normal even after establishing of the circulation, that is the pathological Q wave. It will not comes to the normal even after establishment of the coronary circulation. Okay, hope the concept is clear for this one. Yes. Here is the next question. Okay, so this is also 10-star question, and this question I hope this one asked in our mains exam of the NORCET 7. Okay, yes, I don't know how many of you have given the correct answer for this question. So this is again a 10-star topic. The question is very simple. Read first. Okay, which of the following characteristic ECG finding? Okay, ECG finding in a patient with myocardial infarction affecting the inferior wall of the heart. Students, it is very simple. I will give the mnemonic and how to remember this one, so it will be very easy for you all. Okay, yes, write V1 and V2 lead, then write V3 and V4 lead, then write V5 and V6 lead. Okay, so then write what all are the remaining leads. That is the augmented vector foot you can write, and augmented vector foot, then yes standard lead second, then standard lead third. Okay, so now Write one side V1, V2, V3, V4, V5, V6, then augmented vector foot, standard lead second and standard lead third. Okay, so write here as a S, A, L, A. Okay, right here as a Sala. Okay, so this V1 and V2 lead which tells about the septal MI. Okay, if myocardial infarction to the interseptum or any atrial septum or ventricular septum, so it will always tells us related to the septal MI. And V3 V4 lead always tells about the yes, V3 and V4 lead always tells about the our anterior wall MI, anterior wall MI. Okay, and V5 V6 always tells about the yes, that is the lateral wall MI. Okay, lateral wall MI, very helpful for you all. Okay, and students, consider this one. I will first draw like a triangle of the nth and 11th triangle. Okay, just a second, I am changing the slide here. Yes, students, all of you know that who is the founder of the ECG? That is William Enthoven. So he have given the triangle, okay, like this one. So this is the William Enthoven triangle of the ECG. Okay, so here is our yes, right augmented vector right is there, right hand. So this is our left hand. So here we will apply the augmented vector yes, left lead. Then we will come to the yes, foot. That is the augmented vector foot. Okay, so this is the augmented vector right and this is the augmented vector left. Okay, so this is the right hand and left foot. Okay, so the lead which will apply to our right foot is the lead which will apply to our right foot is that is the neutral. So this one they have asked in the exams many times, which one is the lead that is acts as a neutral in the ECG? That is the lead that is applied to the right foot that acts as a neutral. Okay, hope the one question is clear. And this is what we call as in the William Enthoven triangle, which forms between the yes, augmented vector right, augmented vector left, then augmented vector foot. Okay, and between the augmented vector right and left there is standard lead first. Okay, previously they have asked a question in the one FMC foreign medical services exam. Okay, between the augmented vector right and left which lead will be there? That is the standard lead first. Okay, and between the yes, augmented vector right and augmented vector foot there will be presence of the standard lead second, and between the augmented vector foot and augmented vector left here is the standard lead number third. Okay, so now I will yes, draw a heart in this one. Okay, I will draw a heart in this one. Okay, consider this one is my beautiful heart. Okay, so yes, students, look at this one. What is yes, anterior posterior? So anterior is the front one and posterior is the back one. Okay, what is the inferior and superior? Superior is the up one and inferior is the down one. So in the question what they have asked? In the question they have asked what is the characteristic ECG finding in a patient with inferior wall MI. Okay, inferior wall MI. So inferior means this down one. Okay, so we can say the changes will comes in the standard leads number second. Sorry. Yes, the changes will comes on the standard lead number second, standard lead number third, and standard lead. This is augmented vector foot. So the changes, that is the T wave changes, ST wave changes, or Q wave changes on the standard lead second, standard lead third, and augmented vector foot. So this will always talks related to the inferior wall MI. Hope the concept is clear. Yes, where is the option you search? Yes, ST segment elevation in the lead first and lead augmented vector left. So this is not answer. Okay, ST segment depression on lead 1 and 2. So there is a chest lead 1 and chest lead 2. As I told, this is indicates is septal MI. Okay, so then ST segment elevation on the standard lead second, standard lead third, and augmented vector foot. Yes, this is the our perfect answer for this question. Hope the concept is clear. Yes, read the concept like this, students. This will be helpful for your boosting the marks in the question. Okay, so practice this mnemonic twice, it will be helpful for you all. Okay, so changes in the V1 and V2 leads to the septal MI, changes in the V3 and V4 leads to the anterior wall MI, and changes in the V5, V6 lead to the lateral wall MI, and changes in the augmented ductal foot, second and third, which leads to the, yes, our inferior wall, okay, inferior heart wall myocardial infarction. This is asked in our NORCET 7 exam. Okay, hope the concept is clear for this one. Yes, very nice, students. Yes. So this question brings us to the end of the session. So hope the concept is very much clear for you all. And today I have explained those very important concept. So in each and every question we have see the 10 more questions and 10 more logics. Okay, so 10 more tricks. So that will very much helpful when you will sit in front of your computer on the exam hall. So this logics will comes to your mind. This logic will help you to differentiate and eliminate the option, and this logics will brings you marks in the exams, and which will make you a champion, and which will make you a good ranker. So after getting the good rank, don't forget the master nursing classes. Okay, don't forget your Nagraj sir. Okay, so if you like the video, if you like the content, okay, if you like the explanation, so don't forget to subscribe to the master nursing classes. Okay, try to hit the like button. Your like are the real motivation for me. It helps to me to boost more. Okay, it will help you to search more and give more content to you all. Okay, so be connected and stay tuned with master nursing classes. I am always trying to get the best content in the market. Okay, so always believe in master nursing classes, which brings changes in your life, students. Okay, so with this word I will close this today's class. We will meet again in the tomorrow session. Tab tak ke liye, Jai Hind, Jai Bharat.